the nervous system presentation, or this is going to be the notes over the brain. So again, you can watch these at your leisure, whatever. It's 47 slides, so I'm going to probably move it kind of quick, but these are good as reference. So now that we're going to talk about the brain, we're start with the meninges, and these are the coverings, and these are basically they're between the bone and the soft tissue of the brain, or also in the spinal cord. Dura mater is just the outermost layer, blood vessels. Arachnoid mater is looks like a spider web, and then the pia mater is inner membrane. And dura mater literally means tough mother. And so that these are the we hear meningitis. These are the layers that get inflamed, and so they go spinal cord, I mean brain, all the way down the spinal cord. And so if you look here, you got skin, periosteum, bone, dura, arachnoid, pia, and then the brain. And so um, some of the brains that we're going to dissect next week do have the dura mater still on it. And another, for protection of the nervous system, you do have CSF, which is cerebral spinal fluid. It's this clear liquid. It bathes your brain and spinal cord. It cushions your brain. It serves as a shock absorber. Feel free, if you want to watch a video of a spinal tap. Those who don't like needles, don't do it. But this is just kind of showing you in blue where that cerebral spinal fluid or the CSF flows. So you've got the subarachnoid space, you got your dura layer, and then you have your ventricles. And ventricles are just openings. And so this is just showing you in a brain surgery that dura mater being peeled away. And so you can see it's that tough layer. When we talk about these layers of the brain, we do have to talk about some trauma. So a subdural hematoma literally kind of like a swelling or a blood clot or whatever. It's a type of hematoma, and it's usually associated with traumatic brain injury or TBI, which we'll talk about next week when we do concussions. And the blood gathers between the dura mater and the brain. It puts pressure. And if you remember, there's not a lot of places for that brain to go when that pressure is building up. And so here's the far side, which you can read. So the repair of a subdural hematoma in an 83-year-old patient, you can see the dark red spot there. And then if you do want to watch a video of a tumor while patient's awake, they often will keep the patient awake. Feel free. I'm not going to show them in class. So then after you talk about spinal cord, the spinal cord does pass down the vertebral canal and has 31 segments, each with a pair of spinal nerves, which we've already labeled these bones. The cervical enlargement, it supplies the nerves to the upper limbs and neck, and then the lumbar enlargement down there supplies the nerves to the lower limbs and lower back. And so we do have ascending and descending spinal tracts and nerves. The ascending impulses travel to the brain. Those tend to be sensory, right? If you think about it, sensory is going to go up, brain's going to integrate it, and the descending are the motor. And so again, our nerves are based on a location. So if you remember C1, now this is C1 through C8, which is your cervical, T1 through T12, L1 through L5. And so there's just where the cervical vertebrae, we talked about 7 cervical vertebrae, but there is an 8th nerve there. Let's talk about the brain. There's 3 major parts: the cerebrum, cerebellum, and brainstem. And again, I'll spend more time in class. But your cerebrum is that wrinkly large part of the brain, and this is where the higher mental function solving problems comes from. So when we talked about Phineas Gage right through the frontal lobe. Cerebellum, that's your balance and coordinator. And so what's really cool about, there's really cool things. If you cut the cerebellum apart, there's this white matter, right, within the cerebellum, and it's called the arbor vitae, which is literally the tree of life. So if you look at that image, you can see that arbor vitae branching out through the cerebellum. And then the brainstem, which on the bottom part there regulates the visceral functions, and that's your autonomic system. And so often if people have image damage to that brain stem, right, breathing and those kind of things can be an issue. And so this is kind of showing you where everything is. We'll be labeling a picture in class. So parts of the brain, you have your cerebral hemispheres, there's the left and right, and they're separated by the corpus callosum or corpus callosum. That connects the 2 hemispheres. And so if you see that white track there, you can see where that's the corpus callosum. And there's been some experiments with split brain experiments. And there it is again in a sheep brain. The convolutions of the brain, those are those wrinkles that you've got fissures, a sulcus, and a gyrus. By increasing those grooves, you increase the surface area. And so you have more surface area to, for activity to occur. And then each sulcus or sulci is basically named based on its location. So you have a post-central, you have a precentral, there's your middle frontal, superior frontal, inferior frontal sulcus. So there's all of these kind of different names for these different regions. But what we're going to focus on, we've got a frontal lobe, a parietal lobe, there's your occipital lobe in pink, parietal in yellow, temporal in green, and then the frontal. And then there's that longitudinal fissure separates the right and left sides, which you cannot see. So fissures separate lobes of the brain, and so you have a longitudinal fissure which separates, left and right. You have a lateral which will go on the side, which makes sense, separates the temporal and parietal, and then a transverse is the one in the back. And you're going to be labeling these when you do the brain. But a lateral fissure separates the temporal lobe from the frontal and parietal lobe. I'm just closing out something here. Excuse me, trying to do 3 things at once. So there's another brain. Another far side. So let's talk about the lobes of the brain. And so we've got the frontal lobe, right? Executive function. Then you have a motor cortex as part of that frontal lobe, which deals with movement. Then you have a sensory cortex, which is sensation. And then you have the parietal lobe, perception, sense of world. You have occipital lobe, which is vision. And then you've got your temporal lobe down there. And so there's the functional structural areas. You can pause this and look at this as you want. Let's talk about ventricles. Ventricles are spaces, and these are just fluid-filled cavities that contain the cerebrospinal fluid. So we talk about cerebrospinal fluid, though, that protects, supports the brain. This is showing you a procedure of a spinal tap. And so a lumbar puncture or spinal tap, it's performed in the lower back. And what they do is they take a needle in between the lumbar bones, remove some fluid, and often that fluid is used as a diagnostic tool to look for meningitis. You can look for multiple sclerosis or cancers as well. So association areas, those are just interpret and analyze the information. Again, I'm not going to go through all of those right now. I don't, because of time, I'm not going to expect you to know all the association areas. Brainstem, you got your thalamus, hypothalamus, pituitary, you got your midbrain, pons, medulla oblongata. And so, excuse me, when we look at these different structures, I'm sorry, the diencephalon there has 2 parts, your hypothalamus and the thalamus. The hypothalamus is kind of the regulator. It deals with hormones, your heart rate, blood pressure, body temperature, hunger. And it does attach to the pituitary, which you see there in red. And then the thalamus is the relay station, right? So it kind of sends that information back and forth. Optic tract, chiasma, that's where the optic nerves cross each other. So if you look in this image here where they make an X right there. So, and this is just kind of showing you some more brain images. Then as we move through more of the parts of the brain there in the middle, we have the midbrain, visual reflexes, eye movements, your pons, and then the medulla, which is your heart, respiration, and blood pressure. So the pituitary gland is the master gland, and so what you need to understand is that your endocrine and nervous system work together. So the pituitary gland is part of the endocrine system, right? But it's the master gland, and so it controls hormones, which are long-term change, where the nervous system is short-term. There again, you can see the pituitary gland there in the hypothalamus. There's your medulla oblongata, pons, and midbrain. So the hippocampus, that's where the memory is stored. So that's always an interesting one to talk about. It looks like a seahorse. And so the amygdala, which I pronounced that wrong, amygdala, excuse me, please. Yeah, I just butchered that. I don't know what I was thinking. Amygdala, that stores memories associated with emotional events and then also associated with fear response and aggression. I can't believe I butchered that like that. So if you're watching that, hopefully you recorded that and you can share that with Mrs. Gardner. She'd be so disappointed. But limbic, right, has role in emotions. And so memory, we talk about memory. We used to classify them as long-term or short-term, but now we just, there's a new classification of a memory system that processes information or storage and retrieval. So we're looking at memory there. I'm not going to spend a lot of time in memory, but you have sensory, short-term, long-term, and then long-term can be explicit, implicit, and you have procedural, then you have declarative, episodic, semantic, but anyways. So how important are your memories? And so memories are important. And so, the question is there, like, if you could take a pill to erase your memories, would you? So I'm going to kind of skip through this memory stuff because of time. So you can stop these. We're not going to spend a lot of time on memory. So there are some good brain images there. So, but anyways, that was just a quick run through of the nervous system, the brain. Let me kind of get back to a picture of it. And so feel free to watch us. Kind of help you out. I kind of reduce it down to 10 minutes. So anyways, it's me signing off from 102. Hopefully this is helpful. Like I said, we'll spend definitely more time in class on these, but I just wanted to give you a quick overview. All right, that's it.